Hello, everyone. I hope that you're doing well. Thought I'd provide an overview of your first week of respiratory therapy school. Creating this for my students, however, making it public. So in case there's anyone else that is studying to become a registered respiratory therapist, hopefully, you may find some helpfulness or usefulness of these videos along the way. If you're finding that there's anything that I'm not covering in the videos that you would like to be covered, um, just place it in the comment section or what have you, and I'm happy to try and help accommodate as we move forward. As far as my students are concerned, welcome. Hope you've had a good first week of school. Uh, I just thought we would recap some of the things that we went over during the last week with the intention to try to do a weekly recap of the content and coursework that you've gone over from week to week basis, so that this can hopefully serve as somewhat of a review as we move forward. So this particular session was for our first year group. So this is year one, week one of respiratory therapy school. The courses that we offer this particular semester, the first semester, we've got an intro to respiratory care course. We have an RCP pharmacology course, and we have a clinical practice one course. And our program is a 5-semester program, roughly about 18 months over the course of 2 academic years. We start in the fall semester and we'll go through the spring and summer. We'll graduate in the subsequent spring. So we'll have fall, spring, summer, fall, and spring. Then commencement occurs at the end of the second spring semester. So in your intro to respiratory therapy course, you probably went over some items as such, and I'll pull up those websites here, getting acclimated to the National Board for Respiratory Care. So interestingly enough, in the year 2027, there's going to be a new exam. Previous up to date, we've been taking what's called the Therapist Multiple Choice Exam and the Clinical Simulation Exam, with for short, the TMC and the CSE. As of January 1, 2027, there's a new exam. It's the RTE, the Respiratory Therapist exam. And that'll have 2 different score levels on it. It'll be the CRT, which is Certified Respiratory Therapist, and then the RRT level, which is Registered Respiratory Therapist. That test is going to be 185 questions with 160 items scored. You can find information on the NBRC website. That's the National Board for Respiratory Care, so nbrc.org. Here you can find useful information about the exam. So if you click on the exam tab, you can pull up the detailed content outline. That would be important for you all as you're studying and preparing for your upcoming exam, because you'll be taking the exam, roughly 2 years from now, or 18 months from now, not quite 2 years. So you've got the TMC examination, the TMC detailed content outline. There's also the RT examination, or the RTE. That's going to be the content outline that we're going to focus on. We're tailoring your curriculum to that. So not to be overly verbose, because I want these sessions to be relatively short, but there are free practice exams that you can take. There's self-assessment exams that you can take as well to try to help kind of gauge where you're at as far as your study and preparing. But this is the National Board for Respiratory Care website. This is the credential for respiratory. So you can get the CRT, the RRT. You can also go on and get your adult critical care specialist, you're on the ACCS, and neonatal pediatric specialist, MPS. And if you like to do sleep diagnostics, there's a couple other items you can do, as well as asthma, or if you go like pulmonary function testing, you can go on and get your PFT, RPFT, or CPFT, depending upon if you want to be certified or registered in those. And you can go on to get those. A lot of information about the exam can be found here. Once you get your credentials, you'll maintain your credentials through the credential practitioner portal here as well. So I don't want to, again, not be overly verbose, but just kind of recap some of the things that you would have learned in week one. Additionally, you're going to talk about the American Association for Respiratory Care, the AARC. So you go to aarc.org and you can join as a student. The student membership is cheaper than that of an active practitioner, and you can maintain and should maintain your membership moving forward. There's some discounts that you can get. You also get access to the Respiratory Care Journal. And there's a new item, the respiratory reports, which you can also have subspecialty sections, whether it's education, neonatal, pediatrics, management, leadership, or you may like education as well, or you can look at the significant amount of information that can be found to be helpful here. You see this little tab here for the ARC Congress. It's going to be in Phoenix, Arizona this year. So there's a couple of meetings that's held by the AARC every year. They'll have the summer forum, which is in Fort Lauderdale. I told you all I was in Florida this summer, getting information about the new exam, and we'll be well prepared to handle that as the time comes for that. Then in the fall, there's usually what's called the AARC Congress, and there's more information that are covered there. These are great networking opportunities and good learning opportunities where you can acquire some of your continuing education units and what have you moving forward there. So a lot of resources that are available to you through the AARC. Through the AARC, there are also exam prep resources that are accessible to you. So you can certainly go through the AARC's website and find those out. Now, we're located in North Carolina, so I'm going to pull up information on North Carolina as far as the licensing board. So you've got the National Credentialing Agency, which is the NBRC, which is the webpage that we had looked at just previously. Then you have the American Association for Respiratory Care. It's your professional organization. Then there's state licensing boards. Because we are in the state of North Carolina, I'll pull up the North Carolina Respiratory Care Board website for you. You may have the opportunity to work as a respiratory care assistant, at which point you'll apply for a state license to serve as a respiratory care assistant. But once you graduate, if you haven't worked as an RCA, this is where you'll go to begin your licensure process for the state of North Carolina. By being in the North Carolina Respiratory Care Board or a member of the North Carolina Respiratory Care Board, as long as you're active, you're also a member of the North Carolina Society for Respiratory Care. They also have an annual symposium that will run in the fall. It's a good meeting to get into. They have good vendors and such there. There's also a sputum bowl competition that can be that you can enter there. It's a Jeopardy style type game where you're asked questions. You got a panel of individuals or a team, and then they ask questions, and you go head to head with other students from other programs in the state of North Carolina as well. So that can be pretty beneficial. So that's going to be some of the introductory stuff as far as professional organizations, licensure boards, national credentialing that you've gone over in the first year. And I know that's quite a bit of information to have covered, but welcome to respiratory therapy. There's a lot of stuff to be learned. So that pretty much covers your first week in the introductory class. We all would have also gone over your course policies, procedures, and things of the like. So make sure you're well acclimated those. And talking about policy and procedures, practice guidelines, what have you, go back to the AARC website. For every procedure that we're going to teach you to do in respiratory therapy, there is a clinical practice guideline associated with that procedure. That clinical practice guideline will go over things such as indications and contraindications. Indications are reasons why you would do something. Contraindications are reasons why you might not do something. Of those contraindications, there's really two types. You've got an absolute contraindication and a relative contraindication. Relative contraindications mean there are reasons why you shouldn't do it, but the benefits outweigh the risks, so you can go ahead and move forward and get it done. If it's an absolute contraindication, under no circumstances should you perform that. And we will learn those as we move and progress through the semester and the program with some of the procedures that we may be involved in moving forward. And clinical practice 1, so now we're moving from our introductory class into clinical practice. Clinical practice 1, you probably, again, went over more course policies, procedures, and things of that nature, and want to make sure that we understand those course policies and procedures. Those are going to be the rules that essentially govern your clinical experiences. But in week 1, you probably talked about washing your hands, making sure you remove your jewelry before you wash your hands, getting ready. Maintain cleanliness. That's going to be the number one thing that we can do as healthcare providers to help decrease the amount of spread of infection or the spread of pathogens from one patient to another or even to ourselves. Number one thing we can do is appropriate hand hygiene. There in the hospitals, they do approve those alcohol-based hand gel rubs, which are good. However, we do want to make sure that you are using soap and water if your hands are visibly soiled or you've come in contact with a patient that had something like Clostridium difficile or C. diff, is what you may hear referred to in the hospital. You want to make sure that you wash hands, and the duration for how you wash hands, typically from some type of birthday to yourself, what have you, that usually covers an appropriate amount of time to get your hands washed. In addition to washing your hands, you may have talked about universal precautions, standard precaution, the isolation precautions, whether someone's going to be on droplet precautions, where you might wear a surgical mask, or if they're on airborne precautions, where that might require a fit-tested mask or a PAPR device. Uh, for instance, I would have to wear a PAPR given the beard because the N95 mask would not fit tight enough to my face to be beneficial. So tuberculosis is some of the items that we had talked about. Those individuals also being negative pressure. When you learn how to don and doff your PPE, don is how to put it on, doff is how to take it off. Among your PPE, you've got gown, gloves, eyewear, headwear, whether it's a bonnet or uh, hair cover. Um, we also did shoe covers. We also learned how to put on sterile gloves and maintaining that those gloves remain sterile when you put on. There are going to be a few procedures as a respiratory therapist that you'll either perform independently or assist with that will require you to be sterile. So it's going to be important for you to understand how to do that. So hand washing, your universal precautions, um, and how to put on sterile gloves going to be was a part of your week one. So that was a good review. And then we also have an RCP pharmacology course in our first semester. So that's three of the courses that we have with RCP pharmacology. That was in week one. Uh, you're likely learning terms. That's your intro to pharmacology. So in addition to going over your course policies and procedures, you probably learned about tolerance, which is, if a patient is taking something over time, then they need more drug or different drug. And by drug can have a negative connotation to it. In pharmacology, we utilize the term drug to talk about the medications and so forth that we're going to administer to a patient. So we're laying the building blocks right now. Once you get to about the third or fourth week, next week we'll be going over medical mathematics and drug dosage calculations. So you want to make sure that you pay attention to that. You're pretty much going to encounter some type of math in every course that we have moving forward. As long as you can do basic algebra, solve for X, you really should be okay with any of the math that we're doing. We'll have metric conversions. You're going to talk about those this week or in week two when you get to pharmacology. You also in week one went over, in addition to the general principles, you probably went over the different phases of drug testing, phase 1, 2, 3, and 4, the aftermarket and surveillance, where you need, where after the drug's already approved and put on market, you can follow that as well. What else maybe you've gone over in your first group of pharmacology? Probably the difference between your pharmacokinetics and pharmacodynamics, understanding the differences in what the body does to the drug versus what the drug does to the body, and so forth. You talked about the different stages of that. So when you ingest the medicine and you absorb the medicine, the distribution of your medicine and so forth, the metabolism of the medicine, the elimination of the medicine. So those are some things that you have gone over. These are some concepts that you want to make sure that you are not just learning for an exam and forgetting it, but you're going to want to make sure that you do. Because pharmacology is going to come back semester after semester. In addition, you're also going over your medical terminology. So with medical terminology, if you've not taken medical terminology in the past, we've got medical terminology built into our intro to respiratory care course. It's going to be super important for you to make sure that you know your word prefixes, your root words, and your suffixes, the meanings for those suffixes as well. For instance, if we were to talk about ectomy, the suffix ectomy, that is the removal of or the surgical removal of. So if you had a nephrectomy, neph being the root word for kidney, that lets you know that we're talking about removal of a kidney. Splenectomy would be the removal of your spleen. So it's going to be very important to make sure that you understand medical terminology, the correct pronunciation for those terms, the correct spelling of those terms. Cannot stress enough the correct spelling. Reason being is because some of the words are similar enough to where if you mix up the letters, you may be talking about a completely different part of the body. And all the while, for instance, if you were to take the word uvula versus vulva, and you accidentally misspell one or two of those, you could definitely be, talking about a completely different part of the body not anywhere close. So we'll continue to keep going over some of the concepts and topics. Like I said, if you've got specific items that you would like me to kind of go over in a little bit more detail, I'll try to do that, but I do want to try to keep these sessions, between 5 and 10 minutes if I can, just because that way you're not having to watch a computer screen for an extremely long amount of time. But nonetheless, I want to share what I know of respiratory therapy with you all. So welcome. I'm glad you had a good first week, and I'll look forward to seeing you again in week 2 with another recap of the things that you would have done in week 2. Thank you all and have a good day.